Hi, it's Sia, and today on Pitch to Power, I'm joined by Anju Mathew, the co-founder and CEO of OncoLens, a healthcare tech company that's transforming how cancer care is delivered. Under her leadership, OncoLens has grown to support over 200 cancer centers, helping doctors and specialists collaborate more effectively and bringing advanced treatment options to everyone everywhere, even in smaller communities. Anju has been recognized as one of Northwestern University's top 100 alumni in tech and named a leader in innovation here in Georgia. I'm especially excited to talk to her as she is a woman entrepreneur breaking barriers in healthcare technology and to learn about her journey behind building such an impactful company. Thank you for being here on the meeting with me today. I'm really excited to talk to you about your journey in your company, about cancer and your entrepreneurship. So just thank you.
Oh, sure, absolutely. Happy to help. Tell me a little bit about yourself.
Oh,
But tell me,
yeah.
what grade are you in? And
I'm a junior. I just want to start off with what inspired you to start OncoLens.
well, specifically, OncoLens, ended up as a result of my personal experience that I went through when my father was diagnosed years before with acute myeloid leukemia. So it was a very aggressive form of cancer. And when we went through the process, we actually met with three different physicians, and he had only 2 weeks left to live. It was that aggressive.
I'm sorry.
We met with no, thank you. We met with three different physicians, and each physician gave him a different recommendation. So as the patient and his patient's family, we were left to make that decision ourselves in a matter of just a few hours. So that kind of hit me because I'd come from other industries. My background is actually as an engineer. I started as an engineer and then moved into other industries. But then it kind of hit me that, healthcare, it really is, the patient with one physician, right? You can go for a second opinion, but sometimes that's hard. And also cancer specifically is one that is, can easily be affected by multiple types of physicians. There's subspecialties within cancer. So that's what really triggered me to, as I went through that patient's family's journey, if you will, it really triggered me to think of, okay, this could be done better.
Yeah.
And coming from a technological background, I thought, I should try and fix it as much as I can.
That's nice. I thank you for telling me this.
Sure.
When you
Absolutely.
think back to earlier when you were starting your company, what was one of the toughest challenges you had to face?
Toughest challenges. I would say it was hiring the right team, right? So all the way from, and you go through many challenges. So to give you some perspective, right? So and I'm sure you've learned about this as well, right? So you need to get an MVP in place, a minimum viable product, right? And try and test the market and see if there's a market. Then from there, once you've tested it, and getting your first customer or even the first person to say, okay, I'm going to test it is very, very hard, right? So, but beyond that, I actually found that finding the right team, getting the right team in place was actually the hardest, right?
Okay.
Yeah.
Thank you. So I read a little bit about you before I joined the call, and I
Okay.
saw that you lived in quite a few places growing up. I think Nigeria, then India. So how do
Yeah.
you think that impacted your view on entrepreneurship, or did it change your approach, or?
No, that's a great question. I actually think it prepared me much better for the entrepreneurial journey, because I went through so much change as a child and growing up. That change is a constant in entrepreneurship, right? There's always something new coming at you, or you have to adjust and pivot in different ways. So it made, my ability to take on with change or address change. I feel I take it a little easier than others do. Yeah.
Okay. So, looking on the view of technology, because you said you were in technology before, and it's changing so fast now, like AI and all. How do you see that making an impact on cancer and helping patients?
Oh, I think it can be huge. I don't think we've even started to see what all it can, how it's going to impact us longer time, and I'm very, very excited about it. It may, in fact, in many ways, it may negatively impact my current business. And that's something that we have to be in front of, as an entrepreneur, is like, okay, what are some of the risks to it? But longer term, I think I'll give you a reason why. Because other players in the market who may have struggled to get there to where we are can now get there faster,
Yeah.
right? So the competition can move faster. So I think that's one. So that's a negative effect. But the positive effect, I think, ultimately to the patient is going to be that I think we can get to drugs and very personalized drugs much faster. I think data is going to be much more accessible, and like physicians and providers are going to get much more assistance in that decision and recommendation making process. So I think overall, to me, the patient, I feel like it's all going to be very positive from that standpoint.
Okay.
Yeah.
Do you think your engineering background helped at all in your journey?
It did. It did. And I will be frank, like, after I became an engineer, I was like, I'm not even sure if this was the right thing for me. But several years later, looking back, I think a couple of things. One is engineering built in me a very analytical mindset, right? So you're thinking through problems, you're trying to create and understand or design a new solution, right?
Yeah.
So that was once you have that mentality in your mind, it gets inculcated in yourself. The second piece is because I was actually building a technology, right? Business is on a technology. While I wasn't necessarily coding things myself, but I could at least guide people in the early on process to build the MVP. And even now, when I have a development team, I can still tell, okay, what are they doing? Are they doing things correctly or not? Right. So I can read the code, I can understand the code, I can provide suggestions back to them.
Okay.
Yeah.
And healthcare, it seems like a really hard pathway to build something in, like a hard industry, because people are generally careful with who they trust because it's health. How did you get doctors and patients to just trust you when you started?
Great question. So, my co-founder happens to be my husband as well, right? So
Oh, yeah.
so he was practicing in a hospital. So here, and so for our MVP, we were able to actually go work through his contacts at that first hospital to get that MVP in place. So that was very helpful. I think otherwise, now beyond that, of course, again, it's all like through your contacts, through your early investors, they will help make introductions. So all those become very valuable. I also, I spent a lot of years in healthcare, again, before I came into, before I founded the company. So I also had a network that I had built up there.
Okay.
Yeah.
Perfect. Cool. So what's been one of your most exciting, like, or life-changing moments you've had while you were building OncoLens? Sorry.
Yeah.
So just a moment that stood out to you. It was like a wow moment.
That's a great question. So, a wow moment, or I'll say one that I'm very proud about is actually, so when COVID hit, right? So literally it was, if you may remember some of this, right? So back in 2020, it was in March, right? There was basically it thinks everything just shut down very suddenly, right? Over a weekend. Now, what I feel very proud about was I was able to, I was very worried is how is the company going to get through this transition, right? Because we won't have the chance to talk to hospitals anymore in person, how we used to do it before, how are things going to change? And we had a very small team, so we had 6 people at that time, took a step back and we were like, okay, how do we take advantage of this situation, right? How do we make the best of this situation? And so we all got into a room together and we basically said, okay, we are actually going to redo a certain part of this, the technology or the platform, and make it available to people virtually, right? And support their virtual needs going forward, at least for the next year and a half as we could see it. And that took off. So actually, and so we were able to, the team got together and we were able to, literally within hours, then we disbanded, right? We weren't able to be together.
Yeah.
We all worked remotely and we launched a new solution to cater to hospitals to address the COVID needs in literally 3 days.
Wow. That's like very impressive. That's like you just like use COVID to your advantage. That's so impressive.
Yeah, yeah.
So what do you mean online? Like, how is that working?
So earlier, so what we were doing, I mean, so you can think of what we do as clinical decision support. So we're taking data from patients on the patients, and we are basically assessing and helping multidisciplinary physicians to come together on a case and make the best decision possible, right? So we bring guidelines, what are evidence-based guidelines, or what is recommended, for that type of disease. What is this patient actually going through? So we pull all of that together. What are some clinical trial options, all of that. Now, typically, again, in prior, all of this was done manually before we launched our platform. All of this was done manually. And people would come together in a room with that prepared information and discuss it. So they would then utilize our platform. We decided, okay, we're going to launch this in such a way that they can just all come in remotely into the same system. They can see the discussion, they can actually participate in a discussion like this, right? And if, again, you may not remember, Zoom was not completely ready even then,
Yeah.
right? So we had to patch things up with different APIs to make that happen. Yeah.
Very interesting. Your experience as an entrepreneur in healthcare and tech, is that any different as a woman? Like, is there anything specific as a woman that you see that's different?
Um, maybe, so not so much in launching the company. At least I feel I've been lucky that I haven't gone through that. I've heard of others who have gone through more challenges. And maybe because I also had been in the healthcare space, like I said, reached a leadership position in the corporate world, and also had been an investor myself,
Yeah.
right? So I'd been in the network and I knew that. So I had that inherent support was already there. you know, However, statistically, it is more challenging for women founders to get funded, by, VCs or otherwise. There are just inherent like biases
Yeah.
against women. But I think, in my perspective, everybody, male or female, or whatever, wherever you came from, you have certain hurdles everybody's facing certain hurdles. It really is up to you to try and overcome that and push through that. So the next generation, like your generation, my daughter's generation, won't have to face things like that. Yeah.
Okay. Cool. What advice would you give to young entrepreneurs in this time of day, like this year?
This year, that's a great question. It's interesting. In entrepreneurship, it's very entrepreneurship can be hard, especially if you're doing something around technology, right? Something new, because the timing also matters. However good you are, however good your solution is, I think the timing in the market also matters a
Yeah.
big time, right? So how much pickup you'll get, all of that kind of stuff. I feel like, so getting a strong pulse, if you have a strong passion for something, definitely, spend the time to get a strong pulse of that market. What is this market really about right now, right?
Yeah.
And then what can I take advantage of? I think if that experience and understanding can help you move much faster once you get started.
Okay. Throughout your whole journey, did you have any break points where you thought, "Oh, this won't work," or "I feel like we're gonna fall through"? Like, I know you told me about COVID and you solved that. Were there any more?
Oh yeah. Yes, there are. I mean, there are definitely several that will hit you in between. I think we've had, so, just again, I mentioned about how hiring the right person is, or people are so important, right? And sometimes when you hire the wrong people, you're losing time. And the problem is, and your dad will tell you this as well, right? So when we take on outside investment, right, you're on a clock,
Yeah.
right? So you make some wrong decisions sometimes, and hiring is again one of those that are very hard. You can lose time, right? So you basically, won't hit necessarily the milestones you need for the next funding round, right? So funding becomes at risk, and right, being able to take your company forward. So I think there have been moments like that when I've been like, okay, will we get funded? And somehow the timing has also been a little bad on the worst side for me, because I've always ended up needing funding when the market is not great. It's for funding. So, but we'll work through it. Again, it's just you will have to work a little harder, hit more, knock on more doors to make things happen.
Yeah.
I think also competition, as new competition comes in, and some of them are very strong established players, especially in healthcare, and you just have to, keep innovating much faster, right? And that can be harder, right,
Yeah.
as a smaller company. Yeah.
Okay.
So nothing I would say that said, oh, this is going to stall us completely, but it keeps you on your toes.
Yeah.
Yeah.
Okay. So I'm assuming that my next question was, is there advice you would give to your younger self? But that would probably fill that as well.
Advice that I would give my younger self. Yeah, I think two things. One is, again, be brave, right?
Yeah.
Just go out. If you have a strong passion, don't feel scared about it. Just go out and learn more. I would say definitely learn more about the market, like I said before you jump in, because otherwise you can get there, right? You're
Yeah.
going to be learning in the process, right? I think the other piece is, yeah, just that's in the same lines, and you must have heard this before, right? Building out a very strong business plan, understanding, okay, what are some of the risks? I think those are just very important. I did do those early on, of course. I mean, it's hard to get funded before, but I think I could have moved a little faster if I had spent more time, again, just learning and dabbling in the space much more before I just jumped in.
Yeah. Okay. Um, if outside of work, what do you think keeps you inspired and balanced? Like, do you have anything that keeps pushing you other than just doing it for money or, you know?
Yeah. Well, I mean, I think the good news to me, what I really like about the business I've launched is it's not just about the money. I definitely get a lot of satisfaction from, when we hear a patient was accrued to this trial purely because our platform found them,
Yeah.
right? So I get a lot of satisfaction from that. I think from a personal standpoint, yeah, though I, try to keep it quite balanced. I travel a lot with the family. I have two kids. One is a senior and one is in ninth grade as well. So they keep me busy, and yeah, it's a lot of fun with them. Yeah, but I do other things.
Okay. When you started off, you said it was you and your husband, right? So, and then you had a team of 6. Is this the same thing as like the hiring? You had to find the right people. Like you and your husband were just the first two who started it.
Well, yes, and my husband was, so he helped in finding our initial customers, and he was, in ideas, but he was not full time into this. So my first hire actually was um, an offshore team in India to help build the MVP, right? So that was the first hire, and then that didn't work out very well, managing this team from offshore and all of those kind of things. So eventually my first hire was actually somebody to manage our customers, so a customer success person. And then I got on a VP of development who basically could help manage the team offshore and then build a development team here in the US. Yeah.
Okay. And also, I saw you're already working with like over 200 cancer clinics in healthcare. So that's just amazing. I just want to tell you that's great. Congratulations.
Thank
And
you.
I want to end off with just a little fun question. Of
Mm-hmm.
the of I think 28 countries you've been to, which one did you like the most?
I've actually been to 33 now. Just
Oh wow.
yeah, because I do love
Yeah.
to travel. Which do I love the most? Turkey, I would say. To me, Turkey is just it really is kind of the center of both East and West coming together. And it's just there's so much culture and history. I love history
Yeah.
and just how all these things came to be and stuff like that. And I don't know how much you know about Turkey, but it's like, it blends like Christian culture, Islamic culture, everything,
Yeah.
just like I said, East and West meet together. So I feel it's like you get an element of everything, and their food is amazing as well.
Yeah.
So, yeah, I love Turkey.
Okay. I just thank you for your time. I read about you. I was very inspired. I think you're very talented and you've done so much. So I just appreciate being able to talk to you today and you taking out
Um,
time to be on my podcast.
oh no, thank you for those kind words. Yeah, and always happy to help. Let me know if there's anything you want clarification on or anything like that.
Okay.